The first time that you actually see your baby is, it's overwhelming.
I can see her little toes and fingers, and she's moving around and kicking and smiling sometimes. She's giving us a little grin.
The purpose of the Prenatal Diagnostic Center is to improve the health of the pregnant woman and her fetus in order to diagnose and treat conditions that can harm them. We use state-of-the-art imaging in order to see the fetus, to assess its growth and well-being, to detect anomalies, to determine its genetic makeup, and to perform diagnostic procedures to help us make diagnoses and treat conditions that the mother and fetus may have. Maternal fetal medicine is really the only specialty in all of medicine where we can't see, touch, or hear our patient. We know more about the fetus nowadays, if they've had a detailed fetal anatomy survey, than we do most adults alive today. Hi, Myra. Hi. Nice to see you.
Dr. Xu is incredible. She's so informative and patient and charismatic. It's such a heartwarming feeling. It's so beautiful to see your child on the screen and be like, you are in me. That's you right there, I can see you. Knowing that your child is healthy, that you're doing everything correctly, it just gives you that reassurance that everything's gonna be okay, your baby's great.
I have a couple more weeks to go. I'm very excited, but every time I have a chance to stop by the clinic and actually see her and just to watch her development, it's kind of another way to prepare me for this new addition that's going to be joining our family very soon. The first ultrasound I had, she just has like the umbilical cord is on a different side than usual. They, reassured me that everything was okay. And this is my first, so I wouldn't have known what it was or if that was an issue. I know it's fine, but it's not super common. I've had 2 ultrasounds already, so it's been interesting to compare one visit to the next.
The uniqueness of the Washington Prenatal Diagnostic Center is its collaboration between Washington Hospital Healthcare System with UCSF. We get the best of both worlds. We get to combine the already established excellence in clinical care that we find locally with one of the leading academic centers in the nation and the first in fetal surgery.
I had my normal scan at 20 weeks. Dr. Chu wanted to see if everything looks good. So she did a scanning and he had some intestine problem. So I delivered here. Day 9, midnight, he threw up. Then again in the morning, 6 o'clock, he threw up again. So they wanted us to stay for a night because he had a history of that diagnosis before birth. So they didn't want to take risk. He vomited that was of yellow color, which was a danger sign. And immediately he found positive for twisted intestine. Dr. Pedia had to untwist the intestine and fix it in a place. I am so blessed to have him in my life. He's super nice.
My experience today at Washington Hospital was really wonderful. The staff was really helpful and amazing as soon as I got admitted to the hospital. So I'm really happy with the whole process of the C-section. Dr. Chu was awesome. Every single time I would go to see her and do my ultrasounds and everything, she was really amazing. If she saw any little thing that wasn't normal, that she would bring me back as soon as possible for another ultrasound, and made sure that if their schedule was booked, that they would make sure to get me in no matter what. So it was awesome. Definitely appreciate that.
This is our second daughter born here. Thankfully, everything went smooth, and that's why we stayed here at Washington Hospital because of that experience and the care that they've given for both our daughters and my wife. Yeah, so thank you, Washington Hospital. Appreciate it.
Learn more about prenatal medicine at BayAreaHealthierTogether.com.